ready.
Okay.
Good evening. I will be demonstrating how to do vital signs today. There are 5 steps in doing vital signs. The first step is temperature. The second step is pulse. The third step is blood pressure. And the fourth step is respiration. And finally, pulse oxygen. Now I'll start. Okay. So for the first step, I'm going to go ahead and do temperature. And it's different ways that you can do temperature depending on your clinic. The first way I'm going to show you is the original way, which is oral temperature. Can you remove your mask for me and place this under your tongue? Okay, thank you. And usually when that happens, the blood pressure machine will indicate the temperature. Okay? All right. Okay, the temperature says 99. It's a little hot in here, so don't worry about that. The second temperature you can get is a tympanic temperature, which is a temperature that goes in the ear. And you just want to place this right in the ear. You don't want to shove it in the ear. And then you'll start it. And when the temperature gauge indicate is done, it'll read. It says 98.7. So usually the tympanic temperature is a little like 0.3 degrees under oral. So that's about right. And the third way you can do it also is under the arm. All right, Erica, I'll have you place this under your arm for me. All right. You gotta have it under there good. Let's see. I have to put it. Yeah, inside, right up under there. Be careful now, poke yourself.
Gotcha.
All right. And as you can see, it's indicating 97.9. All right. So that's good. I'll take it off. Okay. All right, so the second step is your pulse rate. And usually, place your arm up here for me. Yes. All right. And I'm gonna just turn on my clock here. I'm gonna take this off for a second. All right, so with pulse rate, you want to use 2 fingers on the brachial artery until you feel for the pulse. All right, and usually I like to start at an even number because you want to do it for at least 30 seconds. And the pulse rate is usually between 70 and 100 beats per minute. We'll start now. So I got him right at 88 beats per minute, so that's really good. All right. Now, for my third step, I'm going to do respiration. And I usually like to do this while I'm doing the blood pressure so the patient doesn't know that I'm actually doing respiration. So I'll go ahead and get that set up now. I'll go one more side, look. Alright, let's see. Alright, so this step I kind of combine the two of respiration and blood pressure since it's kind of hand in hand. So, and I'll kind of explain both of them as I go along. Alright, so you want to start the blood pressure machine. So as the blood pressure is going, you want to sit and count the chest as it rises and falls. So all right, so I got 20, so that's pretty good for respiration. And it's kind of simple to do. So usually how I got this respiration is you want to count the number of chests rises and falls and times that by 4. So it rose and fell 5 times and I just times it by 4, so I got 20. And with blood pressure, you just kind of place the blood pressure cuff, as you seen me do before, right in the middle of the brachial artery, just about 2 inches above. You press start on the blood pressure machine. You let that go. And when it's done getting the first pulse, it'll stop and then it'll drop to get the second pulse, which is the diastolic, and the first pulse is the systolic. And that's how you get the top number and the bottom number. It also do pulse rate, but I did pulse rate manually so y'all can understand. All right, and his blood pressure was 139/86. The norm is between 120/80, but that does vary between patients. So this is fine. It's not too high, it's not too low. So the 5th and final step I'm gonna do is pulse oxygen, and this count his oxygen rate. It's normally a pretty healthy patient is between 94 and 100. So I'm gonna get this unraveled here. Alright, and I'm gonna turn it on and it kind of give you an idea, finger out. Alright, so I'm gonna go ahead and place this on his finger. Start it. Okay, as you see, I kind of let it sit on there a little bit, but his pulse oxygen rate is 98 and his beats per minute is 75, 74, it's just counting the beats. So 98 is really good. Okay. And that is the final step in vital signs. Alright, and there are 5 steps most frequently used during obtaining vital signs, and that is temperature, blood pressure, respiration, oxygen, and pulse rate. Thank you guys.